Hello everyone. So we have Dr. Shahzad Riyaz with us, who's a leading gastroenterologist in Pakistan. Sir, as we are here attending the European Congress of Obesity, we're third day into the conference, and we've attended some very exciting, informative sessions. I want to ask you, sir, what is the few messages or take-home messages that you're taking with you and you'll be sharing with your peers and colleagues in Pakistan, and how has this conference impacted or will impact your practice in Pakistan?
So I think it was very fortunate of me to attend this meeting, and it's a big eye-opener. I think the key thing that I've noticed that in our country at the moment, obesity is being managed individually. So the nutritionalists, the dietitians, the gastroenterologists, endocrinologists, surgeons, etc., are all doing an excellent job, but they're doing it individually. What I've learned here is that world over, the practice has changed. Now we need to move towards an MDT approach, a multidisciplinary team approach. So all the specialties need to sit together to ensure that the patient, has this weight loss. So for example, I'm a gastroenterologist and I do endoscopic sleeve gastroplasty. But me just doing that is not enough. So if I do that and the patient is not given appropriate advice regarding diet, he will not lose weight. So I think the important thing is that all specialties need to sit together and have a coordinated MDT approach. The second advantage of it is that, now because we're moving forward, we can combine these therapies. So for example, with endoscopic sleeve, I can give the patients GLP-1s as well, because the ultimate goal is not only for the patient to lose weight, but to maintain it. So with those two aspects, I think the MDT approach is the key thing that we need to go forward with.
Thank you so much. A very elaborate answer. Just one more question, sir. So we've attended different sessions on semaglutide 2.4 milligram and the quantity and quality data that it offers the patient, along with other metabolic benefits that it has to offer. As a gastroenterologist, I want to ask you, in your viewpoint, what is the most relevant, most beneficial metabolic benefit that sema 2.4 milligram has to offer for your patients?
So I think with that regard, what I have understood and what I would now promote is that the previous thinking was that it was the patient's fault that the weight was going up, okay? But now we know that it's actually complex neurobiological, signaling, hormonal problems that lead to it. So rather than blaming the patient and saying that they have got, lack of willpower or lack of motivation, we now know that it's actually their biology that determines whether they can lose weight or not. And the medications, the newer medications are research-based. So they have proven the fact that even in patients who are very similar, who were using the same diet before, but with the medications, they have started to lose weight up to 15% and even more, and they're maintaining that weight as well. So moving it from a patient blame culture to a medication-led, evidence-based structure is the key thing.
Yeah. So just one last question and I'll let you go. So sema 2.4 milligram has been researched in patients who suffer from MASH and MASLD. Being a gastroenterologist, I'm sure Pakistan is very prevalent in MASH and MASLD, and you must encounter a lot of patients with these complications related to obesity. With the ESSENCE trial of sema 2.4 milligram, how do you think it will change your practice in patients that present with MASH and MASLD?
Massively, because you see, in our country at the moment, we are still, because it's a developing country with regards to, I work in a transplant center, so most of the patients are hepatitis B and C related. However, we are now seeing more patients with MASL, NAFL sort of cirrhosis of the liver. And there are some medications out there that help in adjusting the fibrosis, but they do not affect the metabolic, components of the patient. So weight reduction with these medicines not only help the patient to lose weight, but there is good evidence that it will improve their overall metabolism, reduce the risks of MASL, cardiovascular risks, renal disease risks, etc. So I think the future is towards moving towards, losing weight with these medicines and providing the patients that extra benefit.
Yeah. Thank you so much, sir, for the elaborate.
Thank you very much.
Thank you for being here. Thank you guys for recording it.